Hello, my name is Ravi Vij. I am the Chief Medical Officer of My Cancer Haven. And today I have with me a leading myeloma authority, Dr. Luciano Costa, who is Professor of Medicine and has an endowed chair, the Mary and Bill Battle Professor in myeloma, and is director of the myeloma program at the University of Alabama. He has conducted some very path-breaking recent clinical trials in myeloma, and we're glad to have him here today. Welcome, Luciano.
Thanks, Rob, for the opportunity. It's great to join you and your audience on this platform.
Oh, thank you. We're very grateful for you to be here. So today, Luciano, we're going to talk about relapsed and refractory multiple myeloma. And so obviously, patients, unfortunately, with multiple myeloma, the majority do, unfortunately, at some point or the other, face disease relapse. So we made tremendous progress in frontline treatment. I'm sure we made tremendous progress in relapse refractory. Would you agree?
Yeah, I totally agree. And you're right. I think there is a reality that we eventually will see change on the remainder of our careers, that the patients, at least a substantial number of patients, no longer relapse after initial therapy. But currently, that's unfortunately the case, that most patients would eventually face a relapse. And I think that topic, I think it illustrates very well how fascinating the world of myeloma is, and how challenging it can be. Because I think sometimes we in oncology, try to have very strict, parameters of, this is my first line therapy, this is my second line, this is third line therapy. But it's a lot more complicated than that, as you know. We got to take in consideration not only the efficacy of each particular drug or each particular regimen, but also how do they match with that patient in front of you, right? I mean, and just as important as the efficacy is, what are characteristics of that disease, what prior therapies that patient have, what prior drugs and regimens the disease has become, refractory to, so disease-related factors. But just as important is the patient. Myeloma is a disease that affects mostly people in the last third of their life, when it's common to have, comorbidities, heart disease, lung disease, diabetes, neuropathy, and they all affect or choices affect, the likelihood of the patient developing some toxicity that ends up limiting the therapy. And last but not less important is the patient convenience and preference. Sometimes the patients quite humbly ask you, "Doctor, can I go play golf next month?" My answer is always like, this is the whole point, that you go play golf. Everything else we do is to make that possible. So it's not like, your wife molds around treatment, is the treatment molds around your life. So being able to meet the patient where they are, meet their goals and their preferences is also very important.
So does every patient who's starting to relapse in myeloma require a change of treatment?
That's always a controversial point, as you know. I think in the early days, when the therapies were few,